When it comes to prostate cancer, there's a lot of confusion, anxiety, and misinformation out there. For many men of my generation, those of us who have crossed the threshold of 60, the very mention of prostate cancer conjures up a host of emotions: fear, uncertainty, and sometimes even denial. We've heard stories from our friends, seen family members face the diagnosis, and perhaps even worried quietly about our own health. But with so many myths and half-truths swirling around, how do we separate fact from fiction? Let's cut through the noise and talk honestly about prostate cancer, the myths that need busting, the truths we must face, and the outright lies that could cost us our lives. Prostate cancer is, after all, the most commonly diagnosed solid cancer among men in the United States, not counting skin cancers. This year alone, it's estimated that around 315,000 men in the U.S. will hear the words, "You have prostate cancer." Of those, approximately 30,000 will lose their lives to the disease. That's not just a statistic, it's a wake-up call. Across the globe, in Australia for instance, the numbers are similarly sobering: 20,000 new diagnoses and around 3,000 deaths annually. Behind every one of these numbers is a name, a story, a family. And for those of us in our 60s, the risk is higher than ever. Yet the conversation around prostate cancer is often muddled by outdated beliefs and misunderstandings, some of which can have real consequences for our health. Let's start with one of the most persistent myths. Prostate cancer only affects older men. Now, it's true that the likelihood of developing prostate cancer increases as we age. In my practice and among my peers, the peak age for a diagnosis seems to hover around 65. But here's the hard truth. Prostate cancer doesn't exclusively target older men. Younger men can and do get prostate cancer, especially those with a strong family history or certain genetic predispositions, like the BRCA1 or BRCA2 gene mutations. If your father, uncle, or brother has had prostate cancer, your own risk shoots up. Genetics, as much as age, plays a powerful role. So, if you're a younger man with a family history, don't assume you're immune. Get checked, talk to your doctor, and be proactive. Prostate cancer doesn't care about your birth certificate, it cares about your DNA. Another myth that's caused more than its share of sleepless nights is the idea that prostate cancer always causes symptoms. Many of us start to worry when we notice changes in our urinary habits. Maybe the flow is weaker, maybe we're getting up more often at night, or perhaps we feel an urgency that wasn't there before. These symptoms are common, but more often than not, they're signs of a benign condition called BPH, benign prostatic hyperplasia. This non-cancerous enlargement of the prostate is part and parcel of getting older. Prostate cancer, by contrast, usually develops on the outer edges of the prostate, away from the urethra, the pipe we pee through. Because of this, prostate cancer can grow silently for quite some time. By the time it causes symptoms, it may already be advanced. That's why relying on symptoms alone is a risky gamble. The best way to detect prostate cancer early is through regular screening, especially the PSA blood test, starting at age 50 or earlier if you have risk factors. Waiting for symptoms is like waiting for smoke before you check for fire. It's often too late. Speaking of PSA tests, let's tackle the third myth. A high PSA always means you have prostate cancer. The PSA, prostate-specific antigen test, is a valuable tool, but it's far from perfect. PSA levels can rise for a variety of reasons: an enlarged prostate, infection, inflammation, or yes, cancer. It's a crude measure, not a definitive diagnosis. Over the past decade, advances in imaging, like multiparametric MRI, have dramatically improved our ability to zero in on suspicious areas. If your PSA is high, don't hit the panic button just yet. Further tests, MRI scans, biopsies, help clarify the picture. Think of PSA as your first warning light, not the whole dashboard. It's a signal to investigate, not a sentence to fear. Now here's a myth that's almost comforting in its own way. Prostate cancer grows so slowly it doesn't require any treatment. You've probably heard it said that men die with prostate cancer, not from it. And sometimes that's true. Many prostate cancers are indolent. They grow so slowly that they're unlikely to cause problems during a man's natural lifespan. The Gleason score, based on biopsy results, helps us sort out the slow-growing cancers from the aggressive ones. A Gleason score of 6, for example, signals a non-aggressive cancer that usually doesn't need treatment, just careful monitoring. But not all prostate cancers are so forgiving. Higher Gleason scores mean more aggressive disease, and for these men, doing nothing is not an option. The decision to treat depends on age, overall health, and the specific nature of the cancer. It's not a one-size-fits-all situation. Don't buy into the lie that all prostate cancers can be ignored. Some require action, swift and decisive. Finally, let's address the myth that prostate cancer treatments always cause severe side effects. This is the fear that keeps many men from seeking help. It's true that treatments, especially surgery and radiotherapy, come with risks. The two most common concerns are urinary incontinence and sexual dysfunction. In the past, these side effects could be devastating. Today, though, advances in robotic-assisted surgery and precision radiotherapy have transformed the landscape. Most men recover well, regaining urinary control and sexual function over time. For some, the journey is longer and harder. For others, new experimental treatments targeting just the cancerous spot, rather than the whole prostate, offer hope of even fewer side effects. It's not perfect, and it's not easy, but it's better than it's ever been. And the alternative, doing nothing, can be far worse. Let's pause for a moment. If you're listening to this and feeling overwhelmed, I get it. Prostate cancer isn't just a medical issue, it's a deeply personal one. It touches everything: your sense of masculinity, your relationships, your future. I've sat across from men in my own community, seen the worry in their eyes, heard the tremor in their voices. Some face their diagnosis with quiet determination, others with fear or anger. It's normal to feel lost. But knowledge is power. The more you know, the better equipped you are to make decisions, not just for yourself, but for your family. Prostate cancer isn't a death sentence. It's a challenge, yes, but one you can face with courage, information, and support. Let's talk about what you can do, right now, to protect yourself and the men you love. Firstly, don't wait for symptoms. If you're over 50, or if you have a family history or genetic risk, talk to your doctor about PSA screening. It's a simple blood test, and it could save your life. If your PSA is elevated, don't jump to conclusions. Ask for further testing, MRI scans, biopsies, and expert interpretation. Remember, not all prostate cancers require treatment, but some do. If you're diagnosed, insist on a clear explanation of your Gleason score and your options. Don't be afraid to get a second opinion. Treatments today are more precise and less invasive than ever before. If you're worried about side effects, ask your doctor about newer techniques and support services. You're not alone. There's one more truth you need to hear. Prostate cancer is not just a man's disease. It affects wives, partners, children, grandchildren. The emotional toll can be heavy. If you're facing a diagnosis, reach out. Talk to your loved ones. Join support groups. Connect with others who've walked this path. You'll find strength in community, and you may discover new ways to cope with the challenges ahead. And for those who haven't yet faced prostate cancer, let this be a call to action. Take charge of your health. Eat well, stay active, and don't ignore your body's signals. Understand your risks, and be proactive about screening. Encourage your friends to do the same. Prostate cancer is common, but with early detection and modern treatment, survival rates are higher than ever. Don't let myths or fear keep you from living your best life. As I wrap up, I want to leave you with this. Prostate cancer is a complex disease, but it doesn't have to be a mystery. The myths, old and new, can be dangerous. They can keep us from getting the care we need, from making informed choices, from living fully. The truths, though sometimes uncomfortable, are our allies. They guide us toward better health, longer lives, and stronger families. And the lies, the ones that tell us to ignore symptoms, to skip screenings, or to fear treatment, must be confronted and rejected. We owe it to ourselves and to those who love us. So if this message resonated with you, if you found answers or even new questions, I urge you, don't keep it to yourself. Subscribe to stay informed, comment below with your thoughts or experiences, and share this with the men in your life. Every conversation could be the one that saves a life. We're in this together, and together we can beat the myths, face the truths, and fight back against the lies of prostate cancer. Stay healthy, stay vigilant, and remember, you are not alone.